Hi guys, and welcome to the MSPCA-Angell Live on Giving Day. We're so glad that you could join us. Sorry we were a little bit late, but that's what happens in emergency medicine and the world of animal welfare generally. Today's a really big day for the MSPCA. It's Giving Day, and this is a day when we really celebrate and highlight everything we do for animals, from sheltering thousands of animals before they can find new and loving homes in New England, transporting just as many from areas of the country where adoptive homes are few, to Massachusetts, where we know from you that pets, dogs, cats, what have you, are very much in demand. And also giving millions of pet meals away to people who otherwise might not be able to feed their pets, especially during these really tough post-pandemic economic conditions. It's an especially exciting day today because I'm standing in the middle of the new critical care unit. You guys may have seen it rising like a phoenix alongside our headquarters at 350 South Huntington Avenue. And I'm with Dr. Kiko Bracker, who's a service director here at Angell in our emergency critical care unit. And he's going to tell us all about the new space.
So we're in the new dog ward here. We're just about to begin work here. It's after about 18 months or so of steady construction. We needed to keep working and seeing animals while we were constructing this new area. So it was a bit of a delicate dance to try to move patients around, to stay open, yet still build out and construct up and create this new space. So lots of shuffling of cages around and again, making sure we stay open. But we're right on the edge of fully opening it up, and it looks great from the outside. We have space in this area for isolated areas for dogs to not be with cats, cats not to be with dogs, for avian exotic patients who are very often prey species, so we don't want them mingling with dogs and cats in the same ward. And then there's special rooms for ventilation and dialysis, which are kind of higher end type of therapies that we offer for dogs and cats who can't breathe or whose kidneys are failing for whatever reason. We have a nice, large and expanded isolation area for dogs and cats who might have infectious diseases, who can't be in the general population, who might have respiratory or gastrointestinal infectious diseases like feline upper respiratory virus or canine parvovirus. So there's a chance that they could spread that to other animals if they were in the same hospital space. So they're nice and isolated with negative pressure, so the air doesn't escape from that area. It's then vented to the outside. One thing we particularly like about this area is we have created a specific emergency room, whereas previously our emergency room was the front half of our critical care unit. Now it's sort of an isolated but adjacent space to the critical care unit. So when those sick patients come in from the front lobby or off the street, they'll be able to be treated immediately in a slightly separate space, and then as they're stabilized after IV fluids, initial medications, pain meds, put into the population of cage space in the critical care unit down here. You may have noticed that there's also a second floor, and that's an area for the less critical patients, for our inpatient crowd, who may need IV fluids, urinary catheter, but don't need sort of the same level of intensive care as the patients who are downstairs. We do plan to continue to use the prior critical care unit. It will sort of be repurposed for less intensive patients, but we do still want to work in that space also. We have the capacity for about, I think, 80 or so cages, as well as runs for about 30 cases in this area. So we have increased somewhat our capacity to house sicker patients here. So what are the other issues that we wanted to touch on that were important to highlight here?
You know, I think what's really special is we have some time with a leading veterinarian at Angell, and I know as a pet owner myself, I'm thinking about this seasonal change. We're going from cold weather to warmer weather, and I know that there's a lot we have to think about, right? From a primary care perspective, getting our dogs and cats ready for that, and also new and emerging health threats for them, like we keep reading about the Lone Star tick and more tick-borne diseases. Could you touch on a little bit what we need to be thinking about with regards to warmer weather, especially with dogs, and then maybe tick-borne diseases or other serious seasonal threats?
Yeah, so we certainly do see heat-related illness in dogs, and oddly enough, it tends to happen in the first warm days of the season. So it takes animals and people about 2 weeks to acclimatize to either colder or warmer temperatures, and so you can handle hot weather much better in the end of the summer than you can in the beginning of the summer. So we tend to see dogs who have heat-related problems, heat stroke, heat prostration, in sort of the first few hot days in late April and early May, when they still think it's cold outside and they're still being very active, but their body just isn't used to the warmer temperature. Down with a hose, put a fan on them if they're nearby a stream or a pond, get them immersed and wet, and that immediately begins to cool them down and dissipate that heat by transferring it to the cooler water or by evaporation. Super effective method of animal first aid. Regarding ticks, ticks don't die off in the winter. They just sort of quiet down and hibernate, and so even in warmer days in the winter, ticks will become active. But you're going to notice here, it's probably already happened, that in the next few weeks, anytime the dog is going to go out and brush by some wooded areas, some bushes, when they go to the bathroom or go sniffing for a ball, they're almost certainly going to have ticks on them. So some sort of tick preventative is going to be important. And then after you're in an environment like that, going through the hair, ears, making sure that you can remove ticks as much as possible. Your own diligence can do a really good job of getting those ticks off your dog. We do see ticks on cats. It's a lot less common. They usually spend their time indoors, but they are a potential host for ticks, just as would be dogs.
That's really helpful. So, Dr. Bracker, we talk a lot about emergency service. That's your area of focus here. We're inside the new critical care unit, which is about to open. What else, from your perspective, sets Angell apart? I don't know how many of our fans know the full breadth of the specialty services, for instance. So, can you talk a little bit about, like, no matter what's going on with our pets, how we evaluate and how we treat across all of these areas of the hospital?
You know, one thing that's really great about working at Angell is that we really have all specialties under one roof, whether it's neurology or surgery, dermatology, lab services, of course, or emergency and critical care. It's all within the walls of Angell, so it's kind of the final stop for a lot of very complicated issues, and so being able to solve almost every issue that comes in through the front door is a really gratifying thing, and it makes working at Angell just a very good experience for that reason. And of course, now we have a new critical care unit to sort of be raised up to the level of the medicine that's practiced here. It's really exciting for everybody here.
It is really exciting. When do we expect the new critical care unit to officially open for patients?
Yeah, that's a good question. I have a little bit of a disappointing answer. I don't have a specific time. We've certainly encountered supply chain issues, just like everybody else in the last couple of years, and we need a few pivotal things in order to open up. But I really hope it's going to be in the next sort of month to 6 weeks or so.
Of that. What is it? Final question for you. And if anyone has any questions, you can ask them on the live, and we'll offer them up and see if we can answer them for you. But you're a pet owner. You've been a pet owner for decades. Say a little more about what keeping pets means for you.
Yeah, they're a part of the family. So many families in the United States and around the world find the joy and companionship about that they need with having a cat or a dog or some other animal in their house. It would sort of feel a little bit empty at home, not sharing the couch with a dog and a cat, or sometimes three or four of them at one time. And I, for one, knew early on that it was just a super important part of my life, although I didn't realize that meant being a veterinarian, so everything coalesced. And yes, eventually that did seem like a very logical choice for me. But again, imagining life without dogs and cats in the house is hard for me.
What would we do without them?
Yeah, totally.
All right. Dr. Kiko Bracker of Angell Animal Medical Center, thank you so much for spending some time with us and showing off a little bit of our new space.
Thank you. Thanks everybody for chiming in.